For many years, scientists have been trying to use stem cells to create new treatments. Some stem cell-based treatments are already being used in hospitals and clinics around the world. Others are being evaluated in clinical trials or are still at the research and development stage in the lab. This makes it hard to interpret what treatments are available or worthwhile. We are a team of Australian researchers who have come together with 6 patient advocacy organisations in order to support patients, doctors and regulators to make better decisions about if, when and how to access treatments that use stem cells. In 2022 and 2023, we spoke with people living with multiple sclerosis, arthritis and cerebral palsy, including patients, families and carers, and with professionals working in these fields. The views and experiences they shared provide a snapshot of how people think about stem cell-based therapies, which should be available in Australia, and why. There are 2 main types of stem cells: tissue stem cells and pluripotent stem cells. Tissue stem cells are found in many organs, like the bone marrow, skin, and liver. They can only create cells for that part of the body. Pluripotent stem cells can be created in the laboratory, and they are different because they can become any cell type in the body when given the right instructions. Because stem cells are so varied, scientists are exploring different ways to use them. For some conditions, it is the stem cells themselves that are injected back into the patient, where they make the cells the patient needs. For other conditions, scientists make replacement cells from stem cells in the laboratory and transfer these replacement cells back into the patient. Scientists are also exploring if certain stem cells, called mesenchymal stromal cells or MSCs, can affect the immune system function in ways that benefit patients, such as by reducing inflammation. The only stem cell treatment that is routinely used in Australia at the moment are hematopoietic or blood stem cells from bone marrow or cord blood for the treatment of leukemia and other disorders of the blood and immune system. All other stem cell-based treatments are considered experimental and not yet proven. To test if experimental stem cell treatments do what scientists hope they will do, clinical trials are conducted. Evidence from clinical trials is gathered and assessed by researchers, doctors and regulators like the TGA. Clinical trials assess if a treatment is safe, and larger trials also explore how well this treatment works in practice. Once the regulators judge that the evidence shows that the treatment is safe and effective, it will be authorised for use. If you want to learn more about stem cells, you can visit the Stem Cells Australia website, which has been created by Australian researchers to provide the most rigorous and up-to-date information about stem cells. It is not easy to interpret evidence about possible new treatments as they are being tested. It is even harder to judge whether the evidence is good enough to justify bigger clinical trials or to authorise the treatment for routine use. One really important reason for this is that patients are very different from one another. For example, 10 people with arthritis are likely to have very different pain experiences from one another. A single patient may also experience quite different pain from one day to the next. This makes it hard to compare them and to identify whether or not a therapy has had a real effect. Similarly, 10 children with difficulties in motor skills will not only be different to each other, but they will change day to day as they grow. This makes it hard to compare a child across 2 points in time, and it's even harder to compare one child with another. Another important reason for why it is hard to judge evidence is that experts do not always see and understand evidence in the same way. For example, doctors in different medical specializations may perceive the advantages and disadvantages of a treatment differently. There might also be quite distinct theories about what the cells are actually doing. These differing views are good for producing high-quality research, but resolving them takes time. Conflicting views amongst experts and lack of consistent advice, together with the long wait as evidence is gathered and agreement reached by experts, can be and is confusing and frustrating for Australian patients and their families. How much evidence is enough? How do we decide when there's sufficient evidence to say that a treatment involving stem cells is safe enough, effective enough, and cost-effective enough that we can routinely offer it to patients as one treatment choice they can make? How do we decide if there is sufficient evidence to justify funding more clinical trials in Australia, knowing that clinical trials are very expensive? These questions become more complicated when we also ask what a government regulator like the Therapeutic Goods Administration, which determines what treatments should be made available to patients, should use as criteria for its decisions. These difficult questions cannot be answered by experts alone. The views of patients and their families are important so that research and funding decisions reflect both public priorities and people's experiences. In 2022 and 2023, as part of our research, we talked about these questions with people living with multiple sclerosis, arthritis, and cerebral palsy, including patients, families, and carers. We also spoke with specialist doctors, nurses, consumer advocates, and research scientists. What we found was that consumers were often very well informed and eager to have nuanced discussions with their healthcare providers. Consumers understood that all current stem cell-based therapies are experimental, and they also knew that these potential treatments are almost certainly not miraculous. But even so, a significant number would prefer to be able to access experimental treatments if they wished. We also found that consumers and professionals agreed with each other in many ways. They particularly agreed about the strong need for easier access to reliable and up-to-date information about new treatments using stem cells, including information about how complex these questions are. Both consumers and professionals also agreed they trust and appreciate the high standards and levels of regulation in Australia, even though they were often frustrated by some issues, such as the pace of research and the lack of access to seemingly promising treatments. These perspectives underscore how important it is that patients and their families and carers are included in discussions about funding and assessing potential new stem cell-based treatments. If you're interested in learning more about our research, you can watch our other videos to hear more about what different patient groups shared with us, and you can also read our reports on our website.